telemedicine. The first pilot lasted for 6 months and proof of concept has already been established. This pilot confirms the model's technical feasibility and will be publishing NCG's telemedicine implementation playbook, which will be helpful to all NCG centers as well when it comes to implementation of telemedicine from the technology angle as well as from the process point of view. The second pilot is in progress right now. It's ongoing in a northeast region. So far, it's 19 teleconsultation and 17 patients with a high user satisfaction. That's a output we saw. We will conclude this second pilot by January 2026. Another important initiative NCG is running currently is synoptic reporting, and we are currently in a process of floating a RFP for the same. Synoptic reporting is a standard way of reporting the pathology and radiology findings to the clinicians, and this has even accepted globally as well. So this is going to be a very important initiative, and we will make sure that this application would be available to NCG centers as well. AI/ML, again, we wanted to make sure that we are also working on the AI wave. So NCG KCTO team has already partnered with India AI Mission to launch a catch grant. And as we speak, there are applications which are screened by committee members. We got a huge response of almost 299 applications, out of which 35 are already shortlisted and they are being presented to jury. We are hoping that out of 35, 10 would get listed or at least finalized, and the final grant would be given to them towards February, March 2026. Another important initiative is DHSL, Digital Health Solution Library. As of now, we have 90 plus solutions. And these solutions have different categories like EMR, HMIS, clinical decision support, remote patient monitoring, diagnostic and screening kind of applications. Please go through that. The link is available on NCG website. And any one of you have used any application in your hospital which you think is really useful for others, please get in touch with us. We would love to have the solution listed on DHSL as well. The other initiative is DHFC. It's a Digital Health Foundation course, and it's a one-of-a-kind training for clinical staff on digital technologies. Typically, this training is done by either NCG or EMR vendors before the EMR goes live in certain centers. This has also been appreciated by many of the NCG centers wherever we have done it. That just takes the overall digital literacy of the staff to the next level. With that, I'll pause and I'll request Dr. Pramesh also to address and share the updates before we call upon Avinash.
Thank you, Santosh. I really have very little to add, except that we are very excited about this collaboration with the NABH, where unlike in the past, where several organizations have worked in silos, we are now actually working together in a collaborative manner to have common standards in digital health. We are very excited about a new collaboration with NABH, which will be on defining standards for RIS and PACS. So enabling more and more hospitals, whether they're cancer hospitals or general hospitals, to understand and set standards on what should be the expectations out of digital solutions. And I believe that this will go a long way, along with the NABH push, as well as the ABDM push towards digital health democratization across the country. So thank you very much to the NABH team, to Dr. Kocher, to Avinash, and the entire team at NABH for enabling this. So over to you, Avinash.
Thank you, Dr. Pramesh and Santosh. We're really excited to be, part of this webinar. Thanks for the opportunity. I'll just share my deck.
While Avinash is sharing the screen, team had just shared a poll. I request all the participants to look at the poll and please share your feedback.
So, good morning, everyone. I'll be briefly introducing NABH Digital Health Standards, or DHS as we call it. under the NABH Next Gen initiative. DHS is NABH's strategic initiative to embed digital excellence into healthcare quality and accreditation. Over the next 10 minutes, I will cover what DHS is, why it matters, and how hospitals can benefit from it. So, I'll touch upon three key aspects. One is DHS as a structured roadmap for digital health adoption, a quick overview of the DHS chapters, and how NABH supports hospitals through capacity building and accelerators. Moving on to the next. So, structured roadmap to digital health adoption. So, DHS is not just a compliance checklist. It's a progressive roadmap for hospitals at different stages of digitization. Now, whether a hospital is just starting with HICMR or already digitally advanced, DHS provides clarity on what to do next. So the focus is on safe, reliable, and clinically meaningful use of technology. Now, it's, I think, one of the most important differentiators of DHS, which is its integrated approach. So what we have done is, we have the core standards for hospitals, right, which are the quality standards. So we have come up with a digital health standards for hospitals and clinics, which actually mirrors the quality standards. So it is basically how do you use digital interventions to be able to meet your quality needs of the hospital, which is aligned to NABH. And we did not stop at that. We also came up with a digital health standards for HIS and EMR systems and also clinic management systems. So in a way, if a hospital engages with a NABH certified HIS and EMR, they can be rest assured that they'll be able to comply with the digital health standards for hospitals. And if you are complying with the digital health standards for hospitals, you can be rest assured that it will make your lives very easy to comply with the quality standards of NABH. So very proud to say that NABH is possibly the first accreditation body globally to offer such an integrated and simplified digital framework. Now, this is value realization reported by our DHS certified hospitals. So what do our hospitals tell us is that the DHS standards is actually helping them enhance patient safety and trust. So one of our chapters, which is the COP chapter, it very clearly defines expectations around ensuring quality care to patients and how technology can be leveraged for the same. It is helping hospitals define how to prioritize their IT spending. So, our standards are basically segregated from core to excellence. So, core, commitment, achievement, and excellence. So, it's like a progressive digital journey in itself. So you basically start by complying with the core, and then you gradually move up the maturity ladder. Third is, it is helping hospitals benchmark their existing digital capability vis-a-vis a national standard, right? One of the most important things is actually creating awareness among the clinical staff. So what hospitals are telling us is that it is thanks to the NABH DHS program, it is allowing them to get the clinical IT and quality teams together in one platform to be able to really figure out how to lead an initiative within an organization. Now, the NABH digital standards, it also builds IT infrastructure resilience. So there are two chapters as part of the standards. It provides a very clear blueprint for cybersecurity and IT infrastructure resilience. And I'm sure you all would be aware of the DPDP Act, which just got enacted. The rules just got enacted, and our NABH digital health standards actually takes care of the DPDP Act in itself. Now, the DHS standards, right? It supports hospitals throughout the digitization journey. So under DHS, a hospital can apply. They can then utilize the progressive digital roadmap of the standards to align and implement your digital systems, and then undergo an assessment only when you are fully ready. So you can apply, you can utilize the standards for your own digital journey, and then once you are fully ready, then you go in for the assessment.
Hello, sir. Hello.
Yes, please.
Sir, what is the meaning of digital maturity? Will you please give some example? What is digital maturity?
Like I mentioned earlier, our entire standards is basically segregated in four categories: core, commitment, achievement, and excellence. So core is at the at the base of the platform. So you start with basic digital. So example, your operations part, your HIS part, right? Then you also look at from an information security. As long as your firewalls are okay, you are kind of covering your outer perimeter and internal perimeter. So your basic hygiene in a digital is what is core standards. Then you move into the EMR. Then you move into basically compliance with DPDP, compliance with ABDM. So it is starting from your core basic requirements like your RCM or patient engagement towards deep clinical excellence is the maturity, digital maturity. Hope that answers your question. Okay, moving on to the next. Improvement in KPI. So again, this is reported by the DHS certified hospitals. So DHS is very strongly outcome driven. Hospitals have reported, around 30% reduction in patient waiting times, 100% access to patient records across visits, significant reductions in TAT for diagnostics, discharge, blood issue, and prescriptions. And then, these are the operational and clinical improvements that leadership can, very clearly measure. Uh, DHS is actually a gateway to future quality accreditation. Now, DHS, it actually acts as a low barrier entry point for hospitals that find traditional accreditation very complex or resource intensive. Now, by adopting DHS, hospital build familiarity with digital governance, documentation, and consent processes. And then DHS effectively works as a pre-accreditation digital enabler for NABH entry level or full accreditation. So it is like a stepping stone towards your quality accreditation journey. Now, the DHS accreditation and certification program. So basically, NABH offers two pathways. One is the DHS accreditation, which is valid for 4 years, and there are three maturity levels, which a hospital can choose from. One is silver, gold, and platinum. So as I mentioned earlier, you can select silver, which basically helps you comply with your very core and basic needs of the hospital, which I mentioned earlier. For example, some core modules from HIS perspective, from a information security perspective, not a very complex consent framework, but going pretty low in your, even having a kind of a digital consent rather than a very complex Aadhaar based consent framework. So at a very bare minimum, you start with the silver category, and then as and when your EMR maturity increases, your DPDP compliance increases, you can then move to gold and platinum over a period of time. The DHS certification, it is valid for 2 years and it's focused on the silver maturity. This flexibility basically allows hospitals to choose based on readiness and ambition. Now, DHS basically consists of a digital health framework. It has 3 clinical chapters. It has 5 non-clinical chapters. So in total, there are 38 standards and 182 objective elements. So objective elements are, the element at which a hospital is assessed. So together, these ensure very balanced coverage of clinical safety, operations, IT, and governance. Now, the next couple of slides is basically, each chapter, what they're all about. These slides basically will give you a snapshot of the breadth of the DHS. Clinical chapters focus on care delivery, patient safety, and clinical workflows. Non-clinical chapters, they cover IT infra, data security, interoperability, and governance. And the intent is to ensure technology truly supports care and not just administration. So if you look at it, the AC chapter, it's basically covering the patient side, patient education, patient navigation, hospital admission process. Care of patients is more about the efficient management of illness and promotion of wellness. It connects the nursing stations with consultation services. And then if you look at the management of medication, it monitors your stock, all the stocked medications, uh, accuracy in dosage and frequency. Now, if you look at a maturity perspective, just to give you a simple example, for example, the core will cover in management of medication, it will cover monitor all stocked medications, ensuring they are consistently available and within expiry dates. So that would be a core. Now, accuracy in dosage, frequency, and route of administration will be a commitment. So it will not be a core element, right? So that is how the entire maturity framework has been defined in NABH. Digital infrastructure, it basically includes cross browser compatible systems, secure access to digital systems, data encryption, and active antivirus and firewall. So again, from a maturity perspective, give an example. Your core will cover in motion data encryption, whereas your achievement excellence will cover in transit data encryption. Okay. Then you have digital operations management, where you have efficient management of illness, standardized IT practices, creating digital inventory, restoring data access in terms of a disaster. And then you have finance and procurement management, which basically covers effective asset control, management of procure to pay cycle, stock movement, and all of that. Then there is a chapter on HRM as well, which covers the recruitment process. It monitors and assesses staff performance. Now, these are not core objective elements. While having a employee record is core, but your performance management and all of that they are not core objective elements. They would be more in achievement and excellence. And then finally, you have an information management system where it is about availability of the right information to the right person at the right time, right? And effective management of patient records, and then clinical decision support. Now, clinical decision support obviously is not core objective elements, is more of an excellence objective elements. Coming to capacity building, uh, so NABH, does not expect hospitals to do this alone. We have a very strong ecosystem that has been created to support the DHS adoption. We have a NABH Digital Health Advisory Board, which basically provides the overall guidance at strategy level, and it includes members across clinical technology and academic areas. Our digital health team, we are basically a team of folks who have extensive knowledge of digital health from across India and global markets. We have a DPAC, that's a very interesting thing that we have done, which is the NABH Digital Health Promotion Advisory Council. They play an advisory role to NABH in execution of the initiatives, and they play a mentor role to hospitals and digital mitras. I will briefly touch upon what digital mitras is. And this council basically consists of leading CIOs, CTOs, CDOs, and CMIOs. So we are conducting these DPAC meetings across the length and breadth of the country. We have done it in Tiruchirappalli. We are going to be doing it in Nasik. The whole idea is that whatever your core challenges that you are facing in your digital adoption, if you share that upfront with us, then we have a focused workshop to from the experts to guide you on the journey. We have 100 plus digital health assessors. We have testing agencies for the software standards that we have. And the last but not the least is the digital health mitra. So NABH, we have started a new program to train and certify system integrators on NABH digital health standards. And the whole idea is to support hospitals in NABH certification and overall digital health adoption. So what will happen is from January, you will be able to on NABH website see impaneled digital mitras. And if you are starting on an IT or a digital journey, you may want to have a look at the website, see the impaneled digital mitras, And these digital mitras will play not just a consulting or an advisory role in your digital adoption journey, but they will handhold you through the vendor or the tool selection. They will kind of govern and make sure that the assurance part is taken care of during the implementation, and also post go live continuous support. So it's a very, I would say, path breaking initiative with NABH has started. From a capacity building perspective, we have this digital health foundation course. You can go to this website and basically enroll for it. It's a very innovative initiative aimed at enhancing healthcare standards and practices across India. We have a program on implementation, which basically will support you in understanding how the NABH digital health standard should be implemented. It's a very extensive 2 days virtual program. Then we have a digital health masterclass, which is focused for the CEOs and the owners to help them understand the adoption of digital health technologies. And finally, we do a lot of awareness sessions, on-site awareness sessions, which we call yatras, and virtual through webinars. So objective is to conduct awareness sessions about the DHS program, including benefits, fee structure, and all of that. So we also have a digital health toolkit, which is there on the NABH website. It provides a very clear and structured roadmap for healthcare organizations transitioning to HIS EMR systems. So you may want to go and have a look at it. It will help you in your entire HIS EMR journey, right from planning phase to implementation phase to post go live maintenance and continuous improvement. So to conclude, DHS is about doing digital right, safely, progressively, and meaningfully. It helps hospitals improve outcomes today and prepares them for accreditation tomorrow. So thank you, and we really look forward to you participating in this particular initiative, which will help you and guide you in your digital adoption journey.
Thank you, Avinash, for detailed overview of DHS. I'm sure a lot of hospitals would be excited to go through it, and they will reach out to you guys if they have any questions. There are a lot of questions in a chat. I would request you guys to look at it, and if you can answer offline, we can then continue with the other part of the agenda. Yeah.
Sure.
Thanks.
Yeah. Thank you so much, Dr. Avinash. So I would now like to call upon Dr. Nikhat Shaikh, Group Head Quality and Risk, MOC Cancer Care and Research Center, as she will be presenting the first case study for the day on hospitals' journey towards digital health standards. So over to you, Dr. Nikhat.
So, starting from the DHS journey perspective, just a quote: to sustain longevity, you have to evolve. So, this simply mentions that lasting success, whether in life or in career or in any business, requires continuous adaptation, learning, and transformation to stay relevant and thrive amidst change. With this mindset, basically, the DHS journey had come across at our institute. So starting at 2023 with a simple initiation of a QR scanner to development of our own EHR system, and then ensuring that whether all IT acts and security with the evidence-based protocol adaptation is there. After having the complete adaptation to it, we decided that we will go for the DHS registration for our DHS accreditation. And here currently we are 20 centers digitally accredited. The upcoming DHS journey, of course, will be on continuous adaptation and operational stability with what we have already built up. Then talking about the initiatives and tools when implemented. So keeping in the chapters in the mind, basically the accessibility at appointment system and feedback was the main focus area. So initiation of patients' accessibility through a digital platform was the first step of this journey, to simple appointment scheduling, to interdepartmental coordination, and till the end of the feedback and complaint mechanism, to ensure that we are having a continuous improvement in our journey of DHS. Then was the focus, of course, the care of patients, because we in an oncology setup, it's very crucial that all the IPD checklist or the IPD history is very important for us to ensure that the patient outcome results are at the best. So ensuring the IPD protocols right from the procedure to the nursing care assessment, reassessment, the nutrition, the emergency process management is digitally, defined in the system through, and also the medication management. So here it is again a very crucial role when it comes to cancer and chemotherapy admissions, where NCC prescribed protocols were inbuilt in the system itself to ensure that the accuracy and the protocol management is standardized across all the centers. Then comes your digital infrastructure. These were some new aspects which had come up, but of course, these were very important because initially we had not understood in that perspective regarding the data security for our daily operations, to the IT policy, to the disaster management, where the DHs have beautifully designed and ensured that these gets implemented at least at the basic, and as Avinash sir told, in the advanced level as well. So as you mature, you can advance and you can put across your more stringent protocols in the systems to ensure that your data security is at the good level. So vendor supply chain management, your human resource, of course, many of the organizations currently have a human resource robustly built out, but the TNA, the LMS, the performance appraiser plays a very crucial role here. So these are a few dashboards where you can have easy access with this building in your system as a leader at your organization. So the decision making at your end becomes very easy. Then comes the most important part, which is the of course the IMS part, where the information management system plays a very robust role. So your FHIR and other systems which are there. So the FHIR basically is the primary healthcare standard with open APIs for accessing, searching, and modifying your EHR and exchanging data between IT system. So this plays, the APIs play a very crucial role. So whenever we are building the system, this is a very a robust system which needs to be ensured. This could be now in a cloud application base, or it is based on your mobile apps. The FHIRs also have APIs which let the third party integrate with your existing systems. So basically, the compatibility with the legacy standards evolved from this HLA 7 version 2 messaging to HLA 7 version 3, the clinical document architecture which needs to be designed for this, for all the codings and coding systems across the interdepartments like your laboratory. So LONIC is the one where the integrations for your laboratory investigations can be ensured. So the logical observation identification names and codes, the standard international classification of diseases, the ICD coding, which is currently ICD 11, which is there. So these all parameters crucially play a very critical role whenever you build your IT systems in your institute, and that was the initiation how this built up. Just to demonstrate a case study, so we MOC Cancer Care Centers, as all of you know, we are networking cancer care centers, daycare centers, purely focusing on chemotherapy, immunotherapy, and targeted therapy. So across centers, there are shifts of volume, patient volumes, and staff, but the organization focused on one unified digital software platform to all our clinics and administration domain. The second task definitely in hand was the standardization, because standardization to have across the network was a very challenging thing. So standardization through your e-consent, your digital capturing for safe infusion practices, robustness in the medication error in achieving the patient safety, in built chemo protocols that was in mind, comprehensive data completion achieved through barcoding, your QMS implementation to ensure real-time analysis and RCAs. Then just to brief you, Of course, in any journey, when it is coming to a good win, but of course there were challenges, and the challenges and issues were definitely faced across. So in workflow digitalization, partial digital adoption, continued reliance on manual process, duplication of efforts, then data consistency. This was again the second challenge, where inconsistent data across the centers, incomplete EMR entries, variation in nursing notes, system operationability difficulties integrating with other hospital systems and external labs was the challenge. Software usability, so semi-manual platform prone to error system downtimes, low staff engagement. This was very crucial, where staffs were very not compatible to get in and roll out to the complete digital world aspect. Staff adoption, inconsistent use of digital tools, manual overrides which were common, patient safety, risk of chemotherapy errors, missing consents, incorrect documentation. This was another this. So coming, what is the benefit then, if we as all leaders here sitting want to adopt NABH? So just a thought through came across the organization. Why is digital required for hospitals? So simple ECR, ensure continuity and innovation in your healthcare delivery. Compliance with your government efforts, such as ABDM, where every most of our organizations are enrolled. The IT Act policy, which is there. Real-time data capturing. So this is going to be the future, where real-time documentation and real-time evidence-based things will come across. Why adopt digital practices for accreditation? So again, SRF, we're streamlining accreditation process through automation, real-time compliance monitoring, and reduce paperwork. Focus on patient care over administrative burden. This is very important, where empathetic management and care of patient in our such domain of cancer patients or dealing with cancer is very crucial and important. So this is where it is very important to have DHS. Why prioritize streamlined processes and monitoring? So of course, improved productivity, increased cost efficiency, superior time management, enhanced communication, and risk minimization. So why again enhance safety and coordination through digital tools? So simple IR, that infrastructure challenges like digital tools like telemedicine, AI address, reduce information asymmetry for patients, and ensure scalability during crisis like pandemic, where we have also noticed that in the pandemic situation, many were on AI front, many consultations were done digitally, and addressing to the patients were all on the digital front, which really impacted to overcome the pandemic situation. So why invest in these for long-term hospital success? So simple IPL, this is not the cricket this, but implementation of NABH digital boost operational efficiency, positioning hospitals as future ready with higher quality care and transparency. And this will definitely have a leadership dashboard, leadership accountability, and leadership decision making in the future world. So of course the benefits which is there is staff accountability and training, where digital trials allow monitoring adherence to protocol, to identify gaps where best practices can be inbuilt. The regulatory compliance and accreditation readiness makes a very crucial role, where preparing for adoption for future digital environment, which is the next generation which will be there. So this is definitely a step where we can all focus and ensure that this will help us in the long run. Enhanced patient experience, so real time, as I mentioned, real time monitoring of records and real time identification of errors definitely set us the benefit for patient satisfaction. So the digital world one-stop solution for smoother treatment journey is definitely every one of us sitting here to go on a digital front, where somewhere or other we are definitely capturing the data in a digital way. So making it a complete stop arrangement will definitely help all of us. So again, as all stalwarts here know, that quality is not an endless race, and it is an ongoing journey and not an endpoint.
Thank you very much, Dr. Nikhat. This was really helpful. I'm sure most of us would reach out to you for your experience and journey, and maybe support in terms of what to do when they hit any obstacle. But
Sure.
thanks. I truly appreciate this.
Thank you.
Looks like there are a lot of questions in the chat box. So I would request, the entire group of speakers today to kind of address those questions during the Q&A session. Again, thank you, Dr. Nikhat, a lot for your inputs on this. I would now like to invite Dr. Navin Chugh, who is going to be representing the second case study for the day, which is on the BME app. So over to you, Dr. Navin.
In the meantime, do you want to take a couple of questions from the chat?
Yeah, we can do that, Dr. Pramesh.
Yeah, I can address one of the chat which is mentioned here regarding e-consent. So just to brief, as per the IT Act 2000, wherein Section 2P, it is mentioned that digital signature means authentication of any electronic record by a subscriber by means of an electronic method or a procedure in accordance with the provision of Section 3. So basically, these are hash functions or asymmetric crypto sections. So as per the Act, it is clearly mentioned that when a subject to provision for this section, any subscriber may authenticate an electronic record by affixing his digital signature, and the authentication of the electronic record shall be effected by use of asymmetric crypto system and hash function, which envelops and then transforms the initial electronic record into an electronic electronic digital signature. So basically, this hash function is an algorithm which maps the translation of one sequence of bit into another. As per the IT Act, there are two schools where one of this we sign it on a pad. So basically, that pad signing is also a kind of cryptography capturing of data, where the security what should be there, that no one can again go, no one should be able to again go back to that field and again re-sign it. So if that is inbuilt, definitely there is no risk. And the other way of doing is in a OTP system, or you can have a link based thing where the consent goes, like the OTP goes to your patients and they give a okay, and that is acceptable. So as per the e-consent which I saw, this is what is being described in the IT Act as well.
And thanks, Dr. Nikhat. And just to add on top of it is, you have tools, digital health, digital signature solutions from eMudra, and even Aadhaar authenticated. So there are these sophisticated tools which are kind of, allowed as per the IT Act as well. So IT Act obviously does not allow, an image of the signature. So you have to go through, a e-mudra or a Aadhaar authentication for that to qualify as a digital signature.
So we also have certain, companies who are certified for it. So they are like, you have Zoho and those platforms. So you can opt for it, and that will make a authenticated subscriber for capturing the digital signatures.
There was a question on, we have it's a question on ABDM ecosystem. So the question was, we have been in journey of integrating with ABDM ecosystem and also looking forward for CDSCO certification for RATS PAS software at Telerat Tech Bangalore. Does DHS coincide, overlap, or supervises these certifications? So I am presuming you are a software vendor, right? If I'm not wrong.
Yes.
Okay. So just to let you know, we have not yet come up with a certification for either software as a medical device or software in a medical device. So we not come up with standards for that as yet. With respect, we have standards for HIS and EMR, and for that we have made the ABDM compliance a mandatory prerequisite. Okay. Right. Because the standards for both software as a medical device, and software in a medical device is still in the works, and once that is enacted, that is when NABH will incorporate it as part of the standards.
Okay. Yeah. Thank you. Thanks for
E-consent has already been answered. NABH standards, and the other question was NABH standards for HIS and EMR system includes HRMS and IMS. Usually this is not part of HIS EMR. What other options do we cover? So just to let you know, Mr. Paduhur, that the NABH digital health standards for hospitals is not just about HIS and EMR. It encompasses all the workflows that happens in a hospital, covering all your departments, and not just from a functional workflow perspective, be it either operations or clinical. It also includes your IT infrastructure and patient data privacy. So it basically includes everything connected to a digital world within a hospital. I see Dr. Navin Chugh has joined.
Yes, good morning, all. Thank you for the opportunity. And this is a small case study which we did at HCG, Healthcare Global Enterprises. Okay, I am Dr. Navin Chugh. I had quality for HCG. I'm also principal assessor for NABH and faculty of NABH. So our DHS accreditation journey, it started with the NABH Digital Health Standards for Hospitals 1.0 in 2024. Okay, we were very excited when NABH released the DHS standards, as it marked a very significant milestone, bringing much needed standardization in the digital health process. And DHS is a key enabler for the Viksit Bharat vision, is supporting the India's digital transformation agenda in healthcare. So what it did for HCG, these standards aligned perfectly with our ongoing enterprise-wide digitalization program. It helped us to accelerate several initiatives and strengthen our digital maturity. So what we did is for 5 of our largest hospitals, we submitted the application simultaneously for DHS accreditation, and we went through a rigorous and a comprehensive assessment from NABH. And we were happy that all 5 hospitals, they achieved the NABH DHS accreditation within 45 days. Okay, we were very happy with that. So as part of the NABH DHS 1.0 accreditation, we developed many applications. We even fast-tracked a few of them. We enhanced a few of them to align with the DHS requirements. And the key highlight was that every application was developed by an in-house IT team and our coders, working closely with the corporate quality team and the respective departmental heads to ensure functional relevance and compliance with the DHS standards. Okay, we have not used any external IT support. We have not bought any off-the-shelf product. All these developments are in-house by our own team. So what are the benefits of in-house application? Number 1, the application is fully under our control. It is custom built to meet HCG's specific operational and clinical needs. It is not an off-the-shelf solution which forces us to adjust to process to fit the product. Number 2, Because the systems are owned and managed internally, okay, so because the systems are owned and managed internally, we can continuously enhance and refine them so that as our processes evolve, supporting better management and superior patient care. So this is a very important point. So if everything is in-house, there is no additional cost, and we can customize as and when the processes get refined. So what are the key applications we developed? The A very important application from the biomedical engineering department. It is called the Biomedical Engineering Management Application. This is an in-house development, very comprehensive platform for managing all biomedical engineering department activities. So this ensures the unit level teams and the central teams to monitor and compliance and ensure adherence to the standards. Okay, so previously how this was being done? The biomedical engineering department was a standalone department in a unit. We have 31 hospitals across the country. So if we required any kind of data, any kind of monitoring, we had to call the particular person in the hospital. They used to send us mails, used to send us Excel sheets, and we used to extract data and do the analysis. So that became very cumbersome. But once we developed this application was actually mandated as per the DHS standards. It was one of the requirements. So, because we wanted the DHS accreditation, we fast tracked this application, built this application very quickly, and rolled it out so that we could meet the timeline which has been put up for the accreditation dates. We wanted it out before the NABH assessment happens. Okay, so this helped us a lot. Apart from that, we also developed an EQMP application. An EQMP application is an enterprise quality management program. This is basically a centralized system for tracking and managing quality metrics. It supports all NABH defined indicators as well as HCG's internal quality metrics. Ensures timely reporting, monitoring, and performance improvement across the organization. So in this particular application, all the units, all the HODs, quality teams, operation teams, finance teams are entering data on a month-to-month basis, on weekly basis also. And the analysis comes out at a click of a button. The data transmission to the central team is again real time. We need to just log in into the system and we get all the data for all the hospitals. I don't have to call anyone. I don't have to send emails. They don't have to return emails. So the speed of analysis, the speed of corrective actions, preventive actions is now very fast because data is available at our fingertips. Another important application which we developed was the incident management system. It's an online end-to-end platform to manage the complete incident management life cycle. From reporting to root cause analysis to corrective and preventive action implementation and subsequent verification by the quality team. Again, previously it was paper-based. Data had to be scanned, sent by emails, and people had to look at it, do the analysis. But now it's real time. Central quality team can just look into all the data by just logging into the system. Unit teams can just log into the system. Analysis is ready. For assessment requirements, It's just opening the application for the assessors. Everything is there. Okay, similar thing we are now developing for the online committee meeting management system. Similar platform as per the incident management system. This application has been developed, it has been tested, and currently in the rollout phase. There are two other applications which are currently under development. One is the online nursing roster management system. Okay, we have about 2,000 nurses across the group. This particular management system will help the nursing head at the unit as well as at the corporate level to manage the number of nurses as per the occupancy on a real-time basis. Okay, this is under development. The other application which is currently under development is enabling structured checklist to support internal audits for the NABH 6th edition standards as well as for the DHS 2.0 standards. Okay, so previously we used to do everything on a paper, transfer to Excel sheet and do the analysis. But now through this audit application, what we plan to do is do the audit directly on the application and the analysis comes out just by a click of a button the moment you finish the audit. You don't have to wait. So that is the plan. And again, this is currently under development. Okay, so what were the benefits to HCG from adopting the NABH digital health standards? Number one, it accelerated our digitalization journey, enabling faster deployment and adoption of digital tools across the organization. It delivered greater clarity and standardization of process with all workflows aligned to digital applications. It enabled improved monitoring at both the unit level as well as the central level through real-time visibility of data and compliance. It facilitated quick and seamless data transmission, supporting timely decision making. It provided customized role-based reports for the stakeholders. So stakeholders are getting what they want. Next, it offered a highly efficient analytics tool for the quality department at both the unit and corporate level. And very important, it proved to be very cost efficient as all the applications were developed in-house by our own IT team. And it was completely tailored to HCG's operational and clinical requirements. Thank you very much for your participation.
Thank you, Dr. Navin. This was really helpful. We'll open the floor for question and answers now. So this is the result we got from the earlier poll. You guys can see it on a screen.
I think, Santosh, this kind of resonates with what we have been getting, from the surveys that we've also run, based on which, we have been conducting these DPAC workshops across the country. So like I said, I mean, we just kicked off a new initiative. And Tiruchirappalli was the first one, and now we're going to be doing it across the country, which is basically, and this DPAC is council of, CIOs, CTOs, CMIOs of the leading hospitals in the country. So they basically, for example, the top 3 themes from here, they pick that up and then, they kind of provide a guidance and advisory in terms of what the hospitals can do to, overcome these barriers. So
Yeah, this is really helpful. I think Avinash, give or take, every hospital will face these challenges, right? And then
Right,
any
right.
such initiative from NABH is going to be very helpful.
Sure. So we can do that for NCG impaneled hospitals as well. We can pick up the top 3 or 4 themes, and I can conduct a specific DPAC workshop for them.
Sure,
Also.
sure. Let's work on it.
Sure.
Definitely. No? Uh, I think we are over the hour now, but I want to take a moment to thank you, Avinash. Thank you, Dr. Nikhat, and Dr. Navin as well for the wonderful session. Also, all the audience, being patient while listening as well as asking questions and making this session interactive. I would just have one request to, if possible, all of you switch on your cameras so that we can take a group photo.
Hey Santosh, this is Dilip Hinge from Nightflow AI Solutions. I wanted to thank you and the team for organizing this. This is really helpful. I will accept that we are developing a AI first native platform that is going to help each and every patient, not only in India, but across all developing nations. That's our mission. It was a really good discussion in the chats. I was engaging with a lot of people. I understand how people are reacting to new tech and new adoptions and whatnot. One thing I wanted to ask, I forgot to ask this question earlier, was how, so let's say in India alone, we have roughly, let's say 70,000 hospitals. How many of those are aspiring to be DHS compliant?
Yeah, Avinash, you want to take this question?
Yeah. So to answer your question, I think this probably would be the last question that we take in this call today. See, there are roughly around 1 lakh hospitals in the country. Okay, that's the best guesstimate that we have, and 27,000 of them are NABH certified already, which is the quality accreditation and certification. Now, potentially, we have run a survey. I mean, you'll be glad to know it's a very new standard. We launched it, just last year. And you'll be glad to know we've had 1,800 registrations already.
Okay.
Okay. And out of that 1,800, there are 131 who are already certified. And there are assessments ongoing for another 140. Okay. And what is really gratifying is that almost 60% of the hospitals who have registered are hospitals which are in the bed size from 30 beds to 70 to 80 beds, and that is what is really gratifying for us, because from a NABH mandate perspective, that is the segment up to 150 beds that we really want to focus in tier 3, tier 4 towns and even rural. And we've had registrations from Manipur, we've had registrations from Jammu and Kashmir. So that is the breadth of the interest that is coming through for NABH DHS.
Great,
Thank you.
great. Awesome.
Thank
I
you.
know you asked,
So-
you said this is the last question. One quick follow-up. Maybe you can take 20 seconds to answer this. So
So-
what do these hospitals gain?
You can put it on the chat. We will respond to you.
Yeah.
Thank you.
Philip, in the interest of time, we request you to send the question on chat. We'll definitely get back to you.
Makes sense.
Once
Thank you so
again,
much.
Thank you everyone for attending and have a nice day ahead.
Thank you.
Thank you, everyone.